This show is about how to keep the blood flowing to your feet when you have diabetes. This educational video is not meant to diagnose, prevent, treat, or cure in any manner or by any means or methods any condition of any person. Some pictures have been altered to show conditions or events.
There are self-care behaviors that will keep the blood flowing to your feet. We will go through some behaviors in this video so that you can be informed. These video educational tips you can put into practice for prevention according to your medical team's directions. What can you do to keep the blood flowing to the feet? You can put your feet up when sitting. That helps the blood flow. And putting your feet up while sitting also helps with swelling of the ankles and feet and prevents pooling of the blood. Wiggle your toes for 5 minutes 2 or 3 times a day. Move your ankles up and down and in and out to help blood flow in your feet and legs, and you can also flex your knees. You can do this while you are sitting with your legs up or before you put your shoes on. Try to have set times to do your exercises each day. To keep your blood flowing to your feet, do not cross your legs for long periods of time. That can cut off blood flow to the feet. Get up and walk around every so often if you must sit for long periods of time. Exercise is a good way to keep the blood flowing to the feet. Exercise strengthens the heart and helps the leg muscles pump the blood back to the heart. There are many exercises that are safe and good for people with diabetes. And you should talk to your doctor before you start an exercise program to learn which exercises are good for you. Avoid long periods of inactivity. Get up, walk around, and do some exercises. Reducing stress can lower your blood pressure. Lowering your blood pressure can help prevent clogging of the arteries, which helps keep the blood flowing. Do not smoke. Smoking can lower the amount of blood flow to your feet. Ask for help to stop smoking. Smoking and diabetes greatly increase your chance of amputation. When you have diabetes, healthy food is healthy medicine. Seek help in finding a healthy meal plan. A registered dietitian is part of the medical team. A registered dietitian can help you build a healthy meal plan for your diabetes. Look for a registered dietitian that is also a certified diabetes educator. One of the best ways to control your diabetes and improve the blood flowing to your feet is to lose weight. You may need help in your weight loss efforts. Many people can lose the weight but gain it right back. You may be addicted to the food. Seek help. Try Googling food addiction. Wear loose-fitting socks, such as diabetic socks, which are usually loose-fitting. Do not wear tight socks or anything tight which can reduce blood flow. If you have varicose veins, swollen ankles, or pooling of the blood, your doctor may have you get mild compression socks. Stop. It just said wear loose-fitting diabetic socks and don't wear anything tight, then it said your doctor may have you get mild compression socks. That seems like something isn't right. The answer is you wear loose-fitting socks, so the blood flows without tightness from the socks, so nothing blocks the flow of the blood. But with varicose veins, swollen ankles, or pooling of the blood, there is blockage of the blood flow. And compression socks will help the blood flow better. Everyday socks can be tight-fitting, especially at the top, therefore blocking blood flow. Now we are going to talk about diabetic socks. Diabetic socks are loose-fitting socks that allow the blood to flow. Now we are going to talk about compression socks. Compression socks are tight at the bottom, then slowly get looser as it goes up the sock. With swelling of the ankles, compression socks make the blood flow better by not allowing the swelling of the ankle to cause blocking of the blood flow. Mild compression socks increase the blood flow. If the blood flow is severely blocked, then no compression sock can help but only make matters worse. Compression socks are sometimes used for people with diabetes, with varicose veins, swollen ankles and/or pooling of the blood. In this picture, we can see the blood in the varicose veins, and we can see it flowing in the wrong direction. It is going back down to the foot and ankle. On the leg with the compression sock, the blood is going up to the heart in the correct direction. Your doctor will know the right compression to use for your compression sock to keep the blood flowing. Compression socks are not just tight socks, but are specially made to improve the blood flow. How do you tell if there is good blood flow to the feet? Your feet will be warm. Both feet will look the same. The feet are of a normal color. There will be no swelling. You will have no slow healing ulcers. There will be no pain. You will not have pins and needles-like feelings. There will be no tightness of pain in the calf muscles that worsen with walking and are relieved by resting. Note that over half of people with diabetes have no signs of poor blood flow. The risks for poor blood flow are smoking, high blood pressure, high cholesterol, type 2 diabetes and/or a family history of poor blood flow. As a person with diabetes, it would be appropriate to have a yearly foot exam. If you have complications, your doctor may want to see you more often. There are many ways to check blood flow to the feet. One good way is to check the major pulses to the feet. There is one on the top of the foot and one on the inside of the ankle area. Someone that is skilled can tell if you have blood flowing into the foot when they feel these two pulses. The pulses help in understanding if there is blood flowing into the foot. Further testing may be needed. In summary, put your feet up when sitting, wiggle your toes for 5 minutes, 2 or 3 times a day. Move your ankles up and down and in and out to help blood flow in your feet and legs. Do not cross your legs for long periods of time. Exercise. Avoid long periods of inactivity. Reduce stress. Do not smoke. Eat healthy food. Do not wear tight socks. Wear mild compression socks if needed and recommended by your doctor. Remember, we are friends in the fight for feet. Thanks for watching. If you find this video helpful, please click a thumbs up, subscribe and leave a comment below.